Hi, I'm Dr. Linda Bergal, and I'm a general surgeon here at CHRISTUS in Beaumont, Texas. I started out as a math major in engineering, and I slowly migrated towards medicine, blended my love for social awareness as well as medical and some of the engineering background. When I started medical school, robotic surgery was not yet a well-accepted practice. It started about halfway through my training. They began introducing robotic surgery, and it became part of our training. I was the first graduating class that received robotic training as part of our graduation. Sometimes when I inform the patient that I would like to proceed with robotic surgery for them, they get nervous, and I try to explain to them that even their coffee maker that morning that's programmed to do something and carry out a task that morning of making their coffee is more of a robot than the robotic equipment, but certainly has no artificial intelligence or ability to do anything in and of its own. Every motion of the robot is actually controlled by the surgeon. So the benefits of robotic surgery really is a freedom that the surgeon gains that was partially lost with laparoscopic surgery. When we did open surgery, we really have a more intimate ability to see and manipulate tissue, which was lost with laparoscopic surgery. You just can't get an angle, or you can't get the instrument to do what you want. That was returned to us for robotic surgery, and a lot of surgeons that transition from open to robotic actually find it easier, more natural than laparoscopic surgery. I can see better, I can manipulate tissue better, as well as I have control of 3 arms and the camera, whereas in laparoscopic surgery I do rely on assistants in the OR to manipulate those for me. Specifically, we've seen a rise in robotic surgery in hernia repairs. They allow for a much faster recovery, quick return to activity because the repair is a lot stronger. We do not have to divide your own tissue. We don't make an incision. We do a primary repair, meaning we repair the actual defect of the hernia from the inside, and then we reinforce it with mesh rather than just relying on the mesh to maintain the repair. Well, not everybody is a candidate for robotic surgery. Not everybody stands to benefit. I do tell my patients that some surgeries have been optimized laparoscopically and are not at a point where the robotic equipment is ideal for it. And in some cases, we still have to make incisions, 3 or 4 laparoscopic incisions if you have a tiny, small hernia. Don't really justify the use of robotic surgery at this point. I see a lot of patients in my office that were at some point told, if you have a hernia that doesn't bother you, don't fix it until it starts hurting you. And we really prefer to fix it earlier now that the complication rates are lower, because we found that we fix bigger hernias in older patients, and certainly that is a lot harder. So we do encourage patients that have hernias to go ahead and seek surgical repair. It may be a lot more minor. Well, I'd like to invite as many patients to come in and consider the option. There's a lot of literature online provided by the Da Vinci. St. Elizabeth has some information videos, and if they have some concern and they would like to explore it from the comfort of their home and write down a list and bring it into the office, we're always welcome that.